High levels of sugar, or glucose, in our body can damage our blood vessels and organs over time. Keeping glucose levels in control is very important for people with diabetes to avoid serious problems like heart attack, stroke, kidney failure, eye damage, foot ulcers, and neuropathy. If you have diabetes, here are 5 must-know things that will help lower and control your blood sugar. Number 1. Know your targets. High blood sugar levels usually do not cause symptoms right away. You may be having high sugar levels in the blood that are silently damaging the blood vessels and organs while you don't even know it. So, it's important to check your glucose levels regularly. For people with diabetes, generally your goal is to have a fasting or before meals glucose level between 80 to 130. And glucose levels 2 hours after a meal should be below 180. If your levels are running high, then you will need to check more often so you can adjust your diet and medicines accordingly. You should also get a blood test for hemoglobin A1C, which is a test that tells how the overall glucose control has been over the past 3 months. Generally, the goal is to have a hemoglobin A1C level less than 7%. However, based on your age and other health conditions, your doctors may suggest a different target for you. Ask your doctor about your personal goals. Number 2. Dietary changes. Managing your diet plays a big role in controlling sugar levels. In simple terms, our food contains 3 sources of energy: carbohydrates or carbs, proteins, and fat. Different foods have different amounts of these components. With diabetes, you need to be careful of how many carbs you are taking with each meal. In diabetes, the body is not able to manage high influx of carbohydrates. The more carbs in the food, the higher the spike in glucose levels will be. Typically, patients with diabetes should take between 45 to 60 grams of carbs in each meal, and 15 to 30 grams of carbs in a snack. Check the food labels and do your own estimates. Keep in mind, not all carbs are the same. Some carbs take time to digest and give a steady increase in glucose that is less dangerous, like whole wheat, barley, and starchy vegetables. On the other hand, sweetened foods, desserts, and sugary drinks contain carbs that get digested rapidly and increase the glucose level high and fast. Here are a few diet changes to consider. White breads, roti, and naan are rich in carbs. Cut down on their quantity in your meal and try to use whole grain, barley, or brown breads as they contain fewer carbs and more fiber. Rice and pasta are also rich in carbs. Try to limit eating them to once or twice per week if possible, and use smaller portions. Include vegetables such as spinach, salad, cauliflower, cabbage, broccoli, and carrots in your diet. Use more proteins, pulses, beans, and grains as regular parts of your meal. Avoid bakery items like cookies, biscuits, cakes, rusk, and other such items. Also avoid high sugar desserts. It's okay to have these items occasionally, but make sure to take small portions each time. Avoid regular soda, sugary drinks, sweetened beverages, and juices. Switch to non-sugary drinks instead. Make sure to check the labels of your foods and beverages. Fruits are an important part of our diet as they contain vitamins, fiber, energy, and flavor. They contain a natural carb called fructose, which is generally better than simple sugar. You can eat all sorts of fruit, but make sure to take a smaller portion each time. Examples of one portion is an apple, a pear, a peach, a banana, 1 to 3 dates, a cup of fruit salad, half of a mango, or 6 to 8 cubes of watermelon or honeydew. It's better to plan frequent small meals in your day to prevent high spikes in glucose levels. Also, try to avoid long gaps between meals as the glucose levels can drop low. On a typical day, plan to have 3 meals and 2 small snacks in between. Always keep a snack available in case you have a low glucose. Discuss the dietary changes with your doctor and explore new recipes to enjoy. Number 3. Physical activity and exercise. Regular exercise and staying physically active plays an important role in healthy life with diabetes. Exercise helps our body utilize the glucose in our blood and improve diabetes control. Exercise is also good for blood pressure, cholesterol levels, our heart, brain, bones, weight management, and mood. Aim for 30 minutes of moderate exercise 5 days each week, such as brisk walking, running, cycling, or sports. If it's hard to find time, then consider doing 15-minute sessions twice a day and find ways to include exercise as part of your daily activities. Start with whatever is possible and build up your routine. Number 4, watching out for complications. At times, you may run into issues of having very high or very low sugar levels. Both conditions can become serious problems. It's important to know what to do in these situations and how to avoid them. If sugar levels become very high, like more than 300, it can make a person feel thirsty, have a dry mouth, urinate frequently, feel exhausted or drowsy. Check glucose levels immediately and use medicines or insulin as advised by your doctor. Drink plenty of water to stay hydrated, and if the condition is getting worse, seek medical help urgently. Another dangerous situation is when sugar gets too low. You need to act quickly. If your sugar levels are between 50 and 70, then follow the 15-15 rule. Take something that has around 15 grams of carbs, and then recheck your glucose levels in 15 minutes. Examples of food that contain 15 grams of carbs are half a cup of fruit drink or regular soda, a tablespoon of sugar or honey, or candy. Keep repeating until the glucose level is at target. If the glucose level becomes very low, a person may feel cold, clammy, restless, sweaty, or have a sense of sinking or impending doom. A person may faint, become unconscious, have a seizure, or develop stroke-like symptoms. Act fast and give the person some glucose right away. Start treatment while you are waiting to check glucose levels or getting medical help. If you are having issues with low glucose levels, then contact your doctor to see if any adjustments in your medicines are needed. Always keep a sugary snack with you for such episodes and avoid having long gaps between meals. Additionally, it is also important to look out for long-term complications of diabetes. People with type 2 diabetes or long-standing type 1 diabetes should get annual urine tests and blood tests for kidney function and cholesterol. They should get a yearly blood pressure check and eye and foot exams. You should examine your feet carefully every day to make sure there are no cuts, wounds, or ulcers, as you may not even feel them due to the damage to nerves in the feet. Discuss with your doctor for more details. Number 5, know your medicines. For many people, diet and lifestyle changes are not enough to control diabetes, and they need medicines. There are many different types of medicines available, including pills, injections, and insulin. Learn which of your medicines are prescribed for diabetes and what are potential side effects and precautions when using those medicines. Ask your doctor about how to make routine adjustments to your medicines if your sugar levels are above target or if you are having issues with low glucose episodes. If you experience any side effects, talk to your doctor as soon as possible. Do not be discouraged. Finding the right combination of medicines to get your sugar in control may take some time. Follow up regularly with your doctor. Keeping good control of your sugars and watching out for complications is very important in avoiding serious problems in the future. By being informed and learning these tips, I hope you can better manage your diabetes and plan for healthy years ahead. Stay healthy and help others stay healthy.